We ready? Okay, we're going to get started. Good morning, everyone. Welcome to our COVID briefing here in the beginning of February 2022. Thank you for joining. There's a lot going on in Cincinnati right now. I think we're all very distracted. The commissioner and I were just talking about the severe weather that's coming. And also we've got a sports phenomenon in our community, and we are going to the Super Bowl. Who day, everyone, who day. How about those Bengals? So, but anyway, today we're talking about COVID-19 and where we stand in this community related to COVID cases and the impacts on our community. So we're going to try to focus our conversation. So as always, I'm going to run through the numbers related to COVID. Positive cases in Hamilton County are at 181,261. Hospitalizations are at 5,475, and deaths are up to 1,816. So the positive cases have been decreasing significantly. We've been talking about this positive trend of lower cases week after week. So a couple of weeks ago, we were closer to 16, 17,000 positive cases in COVID-19 week over week. Last week, we were closer to 8,000. This week, we're closer to 5,000. So you can clearly see a dramatic decrease. We're about half. We keep kind of halving ourselves, right? Each week, it's about half of what it was the week before. So that's great news. Positive cases are going down. Hospitalizations, though, are still very high, and the death rate is still significantly high. And, you know, as we all know, these are lagging indicators, but it is something to note that we're, you know, as Greg says, we're not out of the woods yet, but we are seeing some positive trends. One other thing I want to note, and today we're going to have Greg Kesterman on, the Hamilton County Health Commissioner. Renee Mahaffey-Harris, I hope will be able to join us. She's from the Closing the Health Gap, and she had some really interesting data about the impact to communities of color in Hamilton County and our efforts to reach those communities. So we'll see if she comes on. If not, we'll try to get her in next week. But there is something else happening that I want to alert the public to. The Hamilton County courts will resume jury trials beginning February 7th. In 2022, so in a few days here. So I'm going to read this, just a part of the statement so that people are up to speed on this. In light of statewide and local improvement in the severity of COVID spread and in consultation with criminal justice stakeholders, the Hamilton County courts will resume jury trials, petit jury service on February 7, 2022. The Hamilton County courts, under the leadership of Judge Terry Nestor, presiding and administrative judge of common pleas, and Judge Kurt Kissinger, presiding and administrative judge of municipal court, will continue to monitor the situation and will make adjustments based on local conditions. So just an update from the court system. I will tell you, the courthouse is right across from the county administration building, so I can look out over at the courthouse every day, and it has been less busy because of this. And I know it's disruptive, not only for the individuals that are sitting on these juries, but also the folks that are awaiting trial. So it is good news that we're getting back to a more regular schedule over there. And I applaud the judges for keeping track of COVID, responding to what we know is a health threat, but getting back to jury trials as quickly as possible. So with that, I'm going to turn it over to County Health Commissioner Greg Kesterman.
Well, thank you, Commissioner. I appreciate the opportunity to provide an update. And as you indicated, many of our indicators are heading in the right direction. So that's definitely great news. Looking at our active cases in Hamilton County today, we have 27,000 active cases of COVID-19, which is still a whole lot of cases. So there's still a need for folks to be careful when they're out and about, continue wearing those masks and keeping sick at home. That 27,000, though, does compare to just 1 week ago when we were at 36,000. So we are definitely seeing a sharp decline in cases. More graphically is this 7-day case average chart. On January 16th, just 2 weeks and 1 day ago, we were at 2,470 cases per day. This morning, we are at 680 cases per day. So a drastic drop off over the last 2 weeks, which is excellent news. I want to run through real quick, just a brief timeline just to show how we are changing as a county with our caseload. This is November, this is December, January, you recall the entire county was impacted by COVID. And now you can see the entire county, while there still is a lot of COVID, is starting to see some relief in some of our cases. So once again, just excellent news. Let this map, though, be a reminder that COVID is still in our community and having an impact. And so we still must use caution.
Hey, Greg.
Yep.
Can you flip it? So I think it would be very interesting as we make progress in every jurisdiction throughout the county if we're all orange next week. I'm just saying. I like your the use of color.
Not orange and black, though, right? Just orange.
No, not orange and black, just orange.
Very good. This morning's reproductive value is 0.62, which is also great news. We are seeing a contraction of cases. Our region is just slightly higher at 0.66. Our positivity rate this morning for the region is at 22.5%. Hamilton County is just below that, I believe, around 21%, and I'll share that slide here in a few moments. Our hospitalizations continue, as Commissioner Driehaus indicated, our hospitalizations are continuing to decline. Although notice that today we are at 775 people within our hospital systems, which really compares to where we were about a year ago, back in December at our highest peak at that time. So we still have a major impact in our hospitals, although I'm certain that our hospital systems are enjoying some relief from the decline in cases. That 775 compares to just 1 week ago, where we were at 995 individuals within our hospitals. This morning, we have 187 individuals within the ICU and 126 individuals on ventilators. Deaths continue to be elevated. We are seeing anywhere from 4 to 5 deaths per day on average, and each one of those is truly a resident of Hamilton County. So there is, without a doubt, impact in our community. Wanted to spend a minute and talk about demographic data. My epidemiology team analyzed this data, and I just want to touch on a few points. First, for those of you that aren't familiar, counts are the raw counts of individuals that have been impacted or ended up in the hospital as a result of COVID-19. When you look at rates, they are kind of normalized based on the population. So it's a little more easy to compare the different categories while we are talking. Looking at age has clearly had an impact on those who end up within the hospital system. You can see with each jump of 10 years, we see more individuals ending up within our hospital systems. The greatest impact throughout the pandemic has clearly been for those over the age of 80. Sex has had really no impact on hospitalizations. Both males and females have landed in the hospital at about the same rate. Race has had an impact. While we know that more white individuals were hospitalized in Hamilton County, the rate of hospitalizations among Black residents was twice that of white residents. We know that the number one way to stay out of the hospital has been to get vaccinated. And we know, unfortunately, that the rate of vaccination for those that are Black or African American has been lower than that for white individuals. And so we continue to work to make sure that we are able to get vaccine out into the communities where minority populations live. And we are working to make sure that everyone has equal access to vaccine in Hamilton County. The last item I'd like to draw attention to is Hamilton County, pretty much throughout all of the categories, has had a lower rate of hospitalizations when compared with the state of Ohio. And I think we are lucky here to have great hospital systems, many of which you have heard from on this weekly press briefing with Commissioner Driehaus. We are lucky to have them as partners. They have really provided our residents with some amazing care. Switching over to the data related to deaths, once again, age has certainly had an impact. We see higher rates of death among those over the age of 80 throughout the pandemic, particularly early in the pandemic for the Delta variant and the original coronavirus that we were impacted with. Once again, sex has had little difference on those ending up dying as a result of COVID-19. And I think the good news is, while race had an impact on rates for hospitalizations, the rate is much more equal across races for death. So we see better health outcomes after ending up in the hospital across the races. And once again, Ohio has had lower rates, or I'm sorry, Hamilton County has had lower rates when compared with the state of Ohio. Switching over to the level of community transmission for the Centers for Disease Control, Ohio as a whole continues to remain in high transmission, as well as Hamilton County. This morning, we are at 612 cases per 100,000, and our percent positivity is actually a little lower than I just mentioned. We are at 19.7% positive for Hamilton County. We do continue to have an impact with our vaccination efforts. I throw two goals up on the screen in front of us. The first is our regional goal, which was 80%. You can see those over the age of 60. We have met that goal, although we are happy to continue to make progress with those age groups. As far as our national goal, which was 70%, we have been successful getting those over the age of 40 to the national goal, which is fantastic. We will continue to work with all age groups, including those 0 to 19, 20 to 29-year-olds, to make sure that we can get vaccine and have more herd immunity should we see a future variant come through our community. Two last slides here. One is just a reminder, if you're looking for vaccine, testandprotectcincy.com is a great spot to go. It's updated frequently. It also has locations for testing. If you're looking for a testing site, I would recommend that you go to that website. And lastly, if you know someone who is homebound and needs vaccine, our team in Hamilton County can come to you. We are able to bring vaccine out for eligible in-home vaccinations. We have the Janssen, the Pfizer, the Moderna vaccine. We do first shots, second shots, and booster shots. So please feel free to call us or go to our website and we will sign you up, and we'll have a team of nurses come out and provide that vaccination. That concludes my slides, Commissioner. I'll turn it back over to you.
Thank you, Greg. Such a great service from public health, let me just say. We've referred to this 1.5 million that the county has available for testing. So the RFP went out, the responses came in. We had 2 different vendors respond. So that will be in place here soon. And that is meant to be an ongoing testing presence really in Hamilton County. So, as everyone knows, this the need or the demand for testing ebbs and flows. And so we will be prepared in the long term to provide testing as we move forward here in the year, as maybe other sectors decline their availability for testing. The county will still have some availability for that. I just do want to note that. Very good. So I don't see Renee. Maybe we can get this demographic information, Greg, that you shared dovetails very nicely into what Renee was going to talk about. So we'll get to that at a future date. Bridget, why don't we go to questions?
Great. Thanks, Commissioner. First up, we have Chris Wederick from the Business Courier.
Good morning.
Hey, good morning, guys. Just one question today. I'm wondering, so it looks like we're, over the slope, I guess, or sloping down on cases and whatnot. What do you think, Greg, what do you think the new normal, such as it is? I know that's a pretty sketchy phrase with the entire pandemic, but where do you think we settle in terms of cases, assuming Omicron continues to be the dominant variant?
If only I had a crystal ball, I might be able to better answer that. I think looking at what we know so far about this virus is it does seem to do better in the winter months, particularly because we come inside, we're around more people, and it's very similar to other respiratory viruses. So I do think moving forward, just like the flu, we will see increases in winter months. The one good thing that we have, when this virus first came through our community, we did not have any type of treatment. And over the last 6 months, we have really started to develop better care in our hospitals, but we also have some new antivirals. Kind of like for the flu, we have Tamiflu. So if someone gets sick, we're able to quickly onboard an antiviral and reduce the impacts of that illness. And so for COVID-19, we finally have those antivirals, but we don't have much of them. And so over the next many months, hopefully we can begin to stockpile them. And so that if you do get COVID-19, whether it's a current variant that's circulating or a new variant, we will have treatments for you that will help have a better health outcome. So hopefully we're learning more and more to live with this virus, just like we have with the flu.
Thanks, guys. Appreciate it.
Thanks, Chris.
Whoa.
Next up, we have Brian Hamrick with WLWT.
Good morning.
Hey, how are you?
Good.
Appreciate you taking my question. First of all, while we were talking about the treatment, those new pills from Merck and Pfizer are out. What is the availability of those new COVID treatment pills?
Those medicines are going straight to our hospital partners, but from conversations I have with them, we do not have enough yet. And so we're using standard treatments in conjunction with what available medicines and antivirals we have but we really need a lot more to have available for future illnesses.
Do we have any idea what that future might be like? How long before we get those treatment options available to us?
I do not know, but I also know, a big part of that is if people aren't getting sick because cases have declined, it's a lot easier to begin to stockpile and have those medicines available.
The other thing I wanted to talk about was there's a new Omicron subvariant. Are we tracking that, and how do we know how much that's impacting our area?
We are not aware of any of the newest variant here in Hamilton County. It is tracked at a state level, just like Omicron. We are sending specimens off for additional analysis. And so if it's found, we will let the public know. But at this time, not much is known about it. It seems to be spreading just similar to Omicron. It seems to not have significant illness, but that's all very early.
I was talking to Dr. Blatt about this yesterday, and he said the impact could be that this doesn't fall off as quickly as we have seen. He doesn't expect a major impact for it to go back up. But what are your expectations if we see this new subvariant of Omicron in our region?
I'm going to learn as we go. Unfortunately, the message doesn't change. We know how to keep everyone healthy, and we need folks to do their part of keeping sick at home is probably the number one thing today. Get vaccinated if you haven't been vaccinated. Wear that mask when you're in crowded situations. These are the tools that we know reduce the spread of infectious disease.
And I got one more thing, a little off topic here, but Commissioner Driehaus, maybe you can tell us Bengals celebrations. What do we know about that? Where do we stand with those?
Well, I think we're gonna have a bunch of celebrations. That's what I think. There's all kinds of parties being planned, watch parties being planned. As far as the watch party at the stadium, still more to come. There are a lot of moving parts there. I expect that we'll have an announcement later on this afternoon related to that. So stay tuned.
Okay, thank you. I think that's all. Thank you.
Thank you.
Next up, we have Allison Babka with City Beat.
Morning, everybody.
Morning.
Just two quick questions and kind of in the same vein. One, what kind of bump in cases did we see from the Bengals games now that we've had several playoffs and everybody's coming back and happy and yada, yada? And then two, have we seen anything significant coming from schools resuming the in-person learning?
So I would say just high level, really, to answer both of those questions, over the last 30 days, really 45 days, we have had so much COVID-19 within our community and just such a high number of cases. We really cannot differentiate any particular event or activity to have contributed. I think it was just all over our community. So we have not seen any spikes as a result of a Bengals game or celebration. It's possible some of that was herd immunity from so many individuals having illness. It's also possible it was masked within just the high caseload.
Gotcha. Okay. Thanks, guys.
Thank you.
And it appears that completes our questions from reporters. I can wait just a second, see if anybody has a hand raised or.
Okay, well, great. Thank you. Yeah, I think, as we have in the past, these briefings are meant to provide information to folks as needed. And so, Greg, I think with your availability, we'll intend to do one more at least next week and then play it by ear after that to see where we are. The hope is that we don't need to do these, right? that we get this under control and we don't have anything to report, but I don't know that we're quite there yet. So we'll intend to do one next week. Hopefully Renee can join us then. And then we will play it by ear after that. But again, thank you all for joining. Thank you for being partners in spreading the word related to COVID in Hamilton County. Have a good one.